let's talk a little bit about ethical aspects of assessment and evidence-based practice. Assessment is often the first step in treatment and is ongoing throughout the treatment process. So typically, the first time you meet with the client, you'll be engaged in some form of assessment. Whether it's a formal assessment where you're using some type of standardized test instrument, or an informal assessment where you're simply talking with the client, asking questions, and making behavioral observations, you usually start the relationship with some form of assessment. Diagnosis is also sometimes part of the treatment process. Certainly, if you're being reimbursed by insurance, you'll have to make a diagnosis. So you'll be identifying a specific disorder or disorders based on symptoms either that the client is exhibiting that you can observe or symptoms that they're reporting. So both diagnosis and assessment provide direction for the treatment process. The interventions that you choose to use with your client will be informed by your assessment and your diagnosis. But you must take into account cultural considerations when making assessment and diagnostic decisions. Be aware of unintentional bias and cultural patterns of behavior. So some behaviors that will be considered maladaptive in the dominant culture may not be maladaptive within the client's culture. These same behaviors can be very acceptable in the culture. They can be cultural patterns of behavior, and you don't want to assume that they are pathological, that they're indicative of some type of disorder. Certain behaviors may be labeled as neurotic or deviant just because they are not typical of the dominant culture. And you'll have to remember that the DSM-5 uses a medical model. The DSM-5 is published by the American Psychiatric Association, not the American Psychological Association. And so because it adopts its medical model, it conceptualizes problems as residing within the client or within the patient. So whatever problems the patient is exhibiting, the problem is within them. It does not take into consideration social, political, economic, institutional problems that could be contributing to whatever issues the client is having. But you must take into consideration racism, oppression, discrimination before making a diagnosis. So for example, if your client is displaying distrust, paranoia, anger, is that a maladaptive response to a situation, or is it something that in the context of their environment presents something that's adaptive, something that helps them function in that situation? So you don't want to assume that these things are signs of pathology. So the various theories that we'll discuss will differ with regard to how much emphasis they place on diagnosis. Some theories will be of the belief that a diagnosis is important and guides your clinical decision making. Other theories will explicitly say do not diagnose. Certain theories do not believe in the process of diagnosis. But even if a particular theory does not emphasize diagnosis, you need to be involved in a continual process of hypothesis testing about the nature of the client's issue. So even if you're not going to diagnose, you need to be constantly asking yourself, what led to the development of this client's problems? What maintains the problem? And what needs to happen in order for those problems to improve? So always be sort of testing your ideas about what contributes to this issue. And you also must always screen for life-threatening issues like medical issues, suicidality, and schizophrenia. So regardless of whether or not you're diagnosing. So let's talk about ethical aspects of evidence-based practice. So therapists must select the most appropriate intervention for a given client with a particular problem. Now, usually, historically, those decisions have been made based on the client's theoretical orientation. So if I practice cognitive behavioral therapy, I'm going to choose a cognitive behavioral intervention for my client. But recently, there's been a shift toward using empirically supported interventions. So having evidence-based practice, meaning that you're selecting from interventions that have, through research, been found to be effective for clients with these issues. So EBP represents the integration of best available research with clinical expertise in the context of patient characteristics, culture, and preferences. So it's not purely research, it's research combined with the practitioner's expertise in the area and also the client characteristics and culture. There can be pressure to use interventions in a very standardized by the book way. So insurance companies often will want you to implement the intervention in exactly the way that it was used in the research that proved it to be effective. So it can be very mechanistic and ignore the relational aspects of therapy. And those are the complaints that therapists sometimes have about evidence-based practice. These theories that are supported by research are not necessarily appropriate for clients with existential concerns. So existential therapy has to do with clients who want to gain meaning, who want to do a lot of self-exploration. So they may not have particular, behaviors that they're trying to change. They're just trying to gain more insight into themselves and just explore. So these interventions that are supported by research don't necessarily speak to these existential concerns. And there's also potential for misuse by third-party payers. Ideally, evidence-based practice should be used to improve client care, but oftentimes you'll see third-party payers use the research just to contain costs. So they're looking for the least expensive way to treat clients as opposed to the best way to treat clients.